Hi, it's Bree Smith, SN, here to help you succeed in nursing school and on the NCLEX.
In this video, we are covering some more neuro drugs, so check the chapters and timestamps to help you find specific ones you are wanting to focus on. Let's begin. Let's start with anxiolytics, the atypical anxiolytic buspirone as our prototype here. Buspirone is a non-benzodiazepine atypical anxiolytic. Since it is not a CNS depressant, there is lower risk for dependence and sedation, therefore making this drug suitable for long-term treatment of anxiety, panic, and OCD. Paradoxical anxiety is a potential adverse reaction, as are CNS effects such as blurred vision, dizziness, and headache. Patients should be informed that this is a scheduled, not PRN drug, and therapeutic effects may take anywhere from 2 to 6 weeks to manifest. Now we'll cover antidepressants and mood stabilizers. We'll start with some less commonly prescribed antidepressants before covering the first-line treatments. Amitriptyline is a tricyclic antidepressant, which works by blocking reuptake of serotonin and norepinephrine. There are many considerations for this drug, as adverse events can be quite severe. On a less severe level, this drug leads to anticholinergic side effects. Can't see, can't pee, can't spit, can't shh. To help you remember both the name and the side effect, think of the mnemonic Amy trips on a tricycle in the desert. Excessive serotonin can lead to serotonin syndrome, especially if combined with other serotonergic agents such as other antidepressants and herbal supplements such as St. John's wort. Symptoms to watch for include severely high fever, disorientation, and seizure activity. TCAs are also potentially fatal if taken excessively, and therefore generally doses are limited in supply to reduce the risk of purposeful overdose. Some other antidepressants less commonly prescribed these days are our MAO inhibitors, which function to increase dopamine, serotonin, and norepinephrine. Our prototypes here are phenelzine and selegiline. Like the TCAs, our patient is at risk for serotonin syndrome if these drugs are combined with other serotonergic medications. Another major point of teaching here involves the consumption of tyramine-rich food and drink. Tyramine-rich items such as processed meats, cheeses, fermented foods, and wines can lead to hypertensive crisis if ingested while the patient is taking MAO inhibitors. This crisis can lead to severe complications such as cerebral hemorrhage, stroke, coma, and death. Onto our SSRIs and SNRIs, the first-line treatment for depression, since the potential side effects are generally less severe compared to our previous drugs covered. Patient teaching should emphasize that therapeutic effects may not be felt until 4 to 6 weeks since initiating therapy. This, as well as the fact that initial energy increase may be experienced, places patients with suicidal ideation at increased risk for completion. The priority nursing assessment for patients at risk is to ensure that the patient is not having thoughts or plans of suicide. Another teaching element here should address that side effects include sexual dysfunction and weight gain. Hyponatremia is another possibility, which can manifest as lethargy and cramps. This is also something to pay attention to if the patient is taking lithium carbonate, as hyponatremia can increase risk for lithium toxicity. Patients are cautioned against the use of NSAIDs concurrently, as this may place the patient at increased risk for bleeding. Bupropion is an atypical antidepressant, which acts to increase norepinephrine and dopamine availability. Besides being used as an antidepressant, this drug is indicated for assisting with the treatment of seasonal affective disorder and in smoking cessation. Unlike SSRIs, patients may experience weight loss rather than weight gain. A unique side effect for this drug is that it lowers the threshold required for seizure activity, and therefore those with history of seizures or head trauma may be at risk for seizures while on this medication. Now we will cover the mood stabilizing drug lithium carbonate. This drug is used in the treatment of bipolar mania and in the prevention of bipolar depression. It is non-addictive but is a high-maintenance drug since it has a narrow therapeutic range of 0.6 to 1.2 milliequivalents per liter. Adverse effects include nephrotoxicity, GI distress, and tremors. Fine tremors are expected, but coarse tremors indicate toxicity. Remember, the level should be less than 1.5 to stay alive, with symptoms of toxicity presenting once that level is exceeded. Toxicity risk increases with hyponatremia, so patients on SSRIs or diuretics should monitor their sodium levels closely. Signs of early toxicity include coarse tremors, GI distress, and confusion. Moderate toxicity will have the patient presenting with ataxia, hypotension, seizures, and extreme polyuria. Late and potentially fatal toxicity features oliguria rather than polyuria, coma, and death. Earlier interventions will be less invasive, including flushing the patient with fluids and utilizing activated charcoal. If toxicity is more pronounced, gastric lavage may be performed, and hemodialysis may be indicated as the most severe intervention. Patient teaching should emphasize drinking over 2 to 3 liters of water daily to promote renal health and excretion, as well as ensure adequate sodium in the diet. Now we'll touch on antipsychotics, beginning with first generation and then discussing second generation. First generation antipsychotics such as chlorpromazine and haloperidol are utilized in the treatment of the positive symptoms of schizophrenia and acute mania. They are effective for acute breakthrough treatment, but are less commonly prescribed for long-term treatment due to potential for severe adverse effects. By impacting the dopamine cascade, the patient is placed at risk for extrapyramidal symptoms such as acute dystonia, where the patient has severe involuntary muscle contractions which can lead to compromised airway. Tardive dyskinesia is a less severe involuntary movement disorder which manifests with long-term use. Pseudoparkinsonism and akathisia, uncontrollable restlessness, are other EPS that can occur with use. With antipsychotics, the patient is also at risk for neuroleptic malignant syndrome, which manifests as an incredibly high fever, stupor, and vital sign elevation. Other side effects include marked anticholinergic effects, sedation, and orthostatic hypotension. Second generation antipsychotics such as risperidone are more likely to be prescribed for long-term treatment. While EPS are less likely to occur, they still can manifest, and therefore the patient should be assessed accordingly. A more common side effect of use, however, are metabolic impacts, which can lead to the development of hyperlipidemia, diabetes mellitus, insulin resistance, and obesity. The nurse should assess the patient's triglycerides and blood glucose levels, as well as the patient's ability to cope with these side effects. Like the first generation antipsychotics, orthostatic hypotension, sedation, and anticholinergic side effects may also be present for these patients. The last neuro drug we'll touch on are those used in the treatment of open-angle glaucoma, which work by decreasing aqueous humor production and thereby reducing intraocular pressure. Our prototypes here are betaxolol and timolol. The suffix LOL should clue you in that these are beta blocker medications. Since these are beta blockers, potential side effects if systemic absorption occurs includes hypotension, bronchospasm, and bradycardia. To prevent systemic absorption, the patients should be educated to instill the eye drops in the lower conjunctival sac and to occlude the nasolacrimal duct for about 60 seconds. Thank you for watching this quick and dirty review of neurodrugs. While this is far from a comprehensive breakdown, the most commonly emphasized points on the NCLEX and in clinical practice are covered here. Please make sure to utilize your assigned textbooks and modules in addition to this review.
Remember to keep studying and keep working hard.